Acute suppurative thyroiditis. That is the topic. There are so many different conditions involving the thyroid gland. One among them being infection. This infection, it can be either bacterial or viral. This particular one, acute suppurative thyroiditis, means it's a bacterial infection involving the thyroid gland. Usually, it involves age group between 20 to 40 in a younger age group. Now, how this bacterial infection, how it has reached the thyroid gland? There are so many different causes for that. Let me name a few. The common being, there is some infection in the body and through blood spread, it has reached the thyroid gland. The second one being any sort of trauma related to the neck. It can involve the thyroid gland also, and it can result in bacterial infection. The third being any infection near to the thyroid gland. This can spread from there, involve the thyroid gland, and it can result in abscess formation too. These are the few common things, common conditions which can result in infection of the gland. Now, the presentation, the patient complaint. The patient complaint, there is one more thing which I want to tell you. This condition usually involves in a young age group. Suppose the same condition is seen in an elderly age group, we have to think about immunodeficient conditions also, immunocompromised state also. Now the patient complaint. The commonest presentation will be, they'll be saying it started with fever, followed by pain in the neck, in the anterior part, in the front part, and that pain is increasing and we have associated ear pain also. And as the disease progresses, and if they have not taken treatment, they may have difficulty in swallowing, mild cough, and as and when it progresses more, they may have slight difficulty in breathing also. And of course, change of voice. These are the common presentation complaints. On examination, the patient movement will be restricted. The patient will be sitting with the head bowed down. Because if they try to extend the neck, look up, the pain may increase. In the same way, they'll refuse to turn to the right or left because this also can result in increase in pain. That's why. So when we examine the neck, this particular part will be red in color slightly, and when we touch, it will be painful also. Now, we have to come to a diagnosis. So when you do a blood test, the complete blood count and C-reactive protein, the values will be more. ESR, it will be slightly elevated. And when you do thyroid function test which involves T3, T4, TSH, it will be slightly deranged. And we need to do two more tests which we know it is going to come negative in this condition. These are, one is serum thyroglobulin and another being TPO antibody. Then why are we doing this? Because with the same complaint or presentation like severe neck pain, there are other conditions in thyroid gland where this test will come positive and the treatment is going to be completely different. So we have to rule out those conditions. That's why. So in acute suppurative thyroiditis, these two markers will be negative. We want to do an ultrasound scan of the neck and the patient will not be much cooperative because when they keep the probe itself, it will be painful, so they will not be much cooperative. And the report is going to be enlarged thyroid gland. And suppose it is late stage, suppose there is abscess formation, it will be shown in the scan. Now, usually this much of investigation will be more than enough. If we happen to do a fine needle aspiration, put in a needle and send for a test to rule out other condition, and this particular condition will get inflammatory cells present in it. So it furthermore confirms the diagnosis. So these are the tests usually done. Suppose in the ultrasound scan, it has shown there is a suspicion of abscess formation, then we will go ahead and do a CT scan of the neck with contrast to confirm the diagnosis. Usually, CT scan is not necessary. Now coming to the treatment. Now, we have come to a diagnosis and the patient main complaint is pain and we know the cause is bacterial infection. So what we need is high dose of antibiotic and painkiller. Along with that, what we need contrast bath. I'll explain that. See, this particular area is painful. So I want you to apply ice cubes over here, ice cubes in a plastic cover, or you get ice gel from the pharmacy. You can apply over this area for 1 minute, immediately followed by warm application. You can use a small hot water bag. So this ice application will be for 1 minute and warm application will be for 10 seconds only. So soon followed by ice application, followed by warm application. This will go on for 5 times. The same thing has to be repeated 2 times per day, morning and night, and this will go on for 3-4 days. This is called as contrast bath. I'll tell you the reason for that. Now, when you apply ice over this area, the pain, it's a pain reliever. And when you apply warmth over the area, it increases blood supply of that area, so it will help in fighting against the disease. That's why. So this is all about the treatment. This will be more than enough. And by 3 or 4 days, the patient can be discharged also. Now, suppose the ultrasound scan shows abscess formation and we have taken a CT scan with contrast and it also shows an abscess formation. Then we need to put in a needle in that or inside the abscess and do aspiration. Or we need to do incision and drainage. Either way, we have to remove the abscess. Unless it is removed, this condition is not going to be cured. So, in 99.9%, course of antibiotic with painkiller with contrast will be more than enough. So, that is how we manage a case of acute suppurative thyroiditis. Thank you so much.